Hi there, I'm Brett Dowds and I'm a patient advocate for Kidney Wales in North Wales. Today I'm just doing a wee video kind of on my kidney story, but more on treatment choices is how I want to do mine. Unlike my colleague and good friend Sean Ruck from South Wales, he's done a wee bit more in depth than what I'm going to go on. And as you can see, to start off with, I'm not in a dialysis unit, I'm on home dialysis. So I can give you a little bit about me. I have done every single treatment choice possible for end-stage renal patients. I've done peritoneal dialysis as a child and then as a teenager. I've had 2 transplants. My first transplant lasting for 9 years and my second transplant lasting for 5 years. And for the past 10 years I have been back on haemodialysis. I done my first year being back on dialysis in a unit, 4 hours, 3 times a week. What didn't really do me well. I wasn't very well while doing that treatment choice, and at the time I didn't know there was more options than what I had, and sadly I just kind of plodded along. And at the time I was living in Scotland, and I had my own house, I was at uni, I was working, and because I wasn't well on dialysis, I sadly had to make the choice of moving back home. And home is where your mum and my sisters are. To me that's what home is, and they were living in North Wales, so I moved down to North Wales after a year of trying to keep normality, plus doing dialysis, and it went a wee bit wrong is what I'll say. And so I moved to North Wales and I became a patient in a Splitty Gwynedd Bangor renal unit, and as soon as I basically walked in the door, the home therapy team met me and offered me to do home haemodialysis, what I did not know was a possibility. And within a few months, a few weeks of training and a few months of getting the machine and everything into the house, I was good to go. And that's been 9 years that I've been doing home haemodialysis. And I've done, with home haemodialysis, you don't need to be strict on what time of day you do dialysis. As long as you get your dialysis, that's all that matters. My unit at the moment, I think they like you to be doing at least 15 hours a week dialysis, because the more dialysis you get, the better you are. And it's, I started off doing 2.5 hours every day to 6 days, then I went down to 5 days. And then I changed that to doing 3 hours, and then I changed to do 3 hours alternate days, 4 hours, whatever it was. I would change my hours around to suit what I was wanting to do that week. At the time I wasn't doing much, because sadly I had other illnesses that took over my life. And for quite a long time I was quite a bit of a prisoner on dialysis, is how I looked at it. You can see the stripes on my wallpaper. I felt like they were like cell bars, that I was in jail when on dialysis. And it took me quite a while to come to terms with and accept that I'm on dialysis, and I'm going to be on it, whether I like it or not really, because I don't want the alternative. But about 3 years ago now, I came across a very good friend who is also a dialysis patient, and they live, I did not know they were a dialysis patient, they work, travel, they do so much that it inspired me to go, wait a minute, I actually want to try this. So I found out they'd done nocturnal haemodialysis, and nocturnal haemodialysis is 8 hours alternate nights, but I do 6 to 8 hours at least 3 to 4 nights a week, depending on what I'm doing, where I'm going. And these days my life is a lot more hectic than how it used to be. So dialysis fits into my life, and that's the way it should be. Doing nocturnal has been fantastic because it's freed up my day. I don't have the dialysis hangover because I'm not taking off a lot of fluid in short spaces of time or toxins. I've been able to move the larger middle molecules that struggle to come out on your standard 4-hour session, and I have no restrictions when it comes to diet or fluid, because I have a machine in the house. I'm doing it so much that my body is more or less getting a working kidney up to 32 hours a week. That is really is much better for you, and the longevity. I could probably do this for as long as I want. And since I moved on to nocturnal, I was down on the transplant list to get my third kidney. But since I've changed to do nocturnal, I made the choice to come off the list. What a lot of people might think that I'm absolutely crazy for doing that, but I have 100% antibodies to start off with. I've got other stomach problems that if they started going in cutting me up again, that could bring that back, and I spent a good few years really ill because of that. And I'm not willing to take the gamble that I'm going to be as healthy as I am right now. And yes, I might be stuck to a machine, but the way I look at it is that I've got a good quality of life. And to me that's 10 times more important than just ticking a box that I've had a transplant or that I've went down and had another kidney. And don't get me wrong, it was not an easy choice. It took me a good 6 months, and I spoke to patients, I spoke to clinicians, I spoke to surgeons, I spoke to nurses, psychologists, you name it. I spoke to so many different people and got a good view on what everybody else thought about it. And then I finally made the decision for myself, because at the end of the day it was my choice. And to be honest with you, it's been a very freeing choice, because I'm not worrying about transplant, getting the call, etc., because it's not going to happen. I don't stress that I'm never going to get that call anymore. It's taken a sort of weight off me. That it's been great for me. It's been my choice at the end of the day, because it's about me. But don't get me wrong, once science moves on and I can make a kidney grow in my own body, then sign me back up. But for the present time, I'm happy with what I'm doing. And due to me doing nocturnal, life has took an even bigger turnaround. I now work for Kidney Wales, and I'm the North Wales patient advocate, and that keeps me very busy. I'd say it keeps me out of trouble to a certain extent. But yeah, life is what I thought it would never be, and to be honest with you, I never thought having a chronic health condition would give me the skills and experience that I need to have a good job. I thought I was just going to be left on dialysis as I'd never accomplishing anything. As for now, I'm happy to say that I work, and my work started off with me doing voluntary work for the charities, not just Kidney Wales but other charities, and getting really involved with the charities, that what they've got to offer, getting involved with other patients. Like some of my best friends these days are other renal patients, but then it's not, we don't just talk about kidneys. We've got so many other things in common that they're the ones that I turn to whenever I've got an issue, whenever I've got a problem. And I just recommend that get out there, get involved, meet other patients, and also when it comes to your treatment, at the end of the day it's your choice, and you should always speak it over with your team and make your choices to what fits best for you. I'm a big advocate for nocturnal hemodialysis because it has made such a change in my life, but that doesn't mean that that's the same, that's right for everybody. But yeah, thank you.